Hello and welcome to our Period 3 Molecular Biology Laboratory discussion. So, the topics that will be covered in this discussion are the ones that are included in your laboratory examination this week. So, please pakiaral po yung mga step-by-step procedure and then yung mga definitions natin later on. So for the outline of the topics, number 1, yung proper pipetting techniques, the step-by-step procedure, the what to do and what not to do in doing your pipetting, also the specimen collection for COVID-19 testing. Lahat po yan included sa ating laboratory examination. So a few reminders for your biosafety reminders, even sa different section of the laboratory po tayo mag-work, this is also applicable. Number 1, please wear your proper PPE, your personal protective equipment. We have the manner of sequence. If donning yung gagawin natin, yung proper sequence naman, if doping, alam kong kabisado nyo na yon. Lab gown over scrub suit, disposable waterproof lab gown, closed shoes, and shoe covers. N95 respirator masks are being utilized when we're dealing with samples that produce aerosols, such as yung mga sputum natin and then yung mga nasopharyngeal swab. Again, N95 respirator masks are only used or being utilized if we're dealing with samples that produce aerosol. If nasa St. Jude College Laboratory tayo, yung mol bio natin doon, we don't need to use N95 respirator mask kasi ang mga pinaprocess natin doon, mga DNA samples lang, kagaya ng mga makukuha natin sa ating tissues, sa ating mga hair roots, sa mga tissues ng mga fishes, ng mga chicken. So no need to use N95 respirator mask. So goggles or face shields, kailangan din po natin yan para ma-avoid yung mga talansek. Next, papasok na yung principles natin ng ating good laboratory practices which can be applied to different sections of the laboratory. Disinfect all working areas, surfaces, and equipment before and after use with 10% bleach and followed by 70% ethanol. Next, no gadgets inside the laboratory. So in our lecture part for your period 3, we were able to discuss the different equipment, materials, and consumables that are being utilized inside a molecular biology laboratory and COVID-19 testing laboratory. So one of which is yung ating micropipettes. So pipettes, madami talaga yung types and categories na ginagamit sa different sections of the laboratory. And i-share ko lang po na ang ating pipette, ito ay isang recall question on your March 2022 Licensure Board Examination for Medical Technologies. So it will be further discussed on your clinical chemistry, yung mga to deliver, to contain different types of pipette. But for molecular biology, let us focus on your micropipettes. Again, micropipettes po ang focus natin dito kasi sa different sections of MolBio, talagang ginagamit ang micropipette. So, start po muna tayo sa ating right side. Pag-usapan po muna natin si plunger button. Okay, plunger button. Ito yung pinaka-kiniklik natin or yung ginagamitan ng thumb para i-press para po tayo ay mag-contain ng sample. Number 2, yung plunger shaft. Yun yung parang pinaka-body niya or torso. We have the grip pin naman dito. Dito naman natin ilalagay yung ating grip or yung hawak natin, yung pressure nandito po sa grippy. Next, we have the tip ejector kung saan pinipress din po siya para ma-eject or matanggal natin yung ating pipette tips. Next, we have the display. Okay, kung yung ating mga cellphone at laptop meron siyang screen para sa display, yung ating pipette tips or ay ang ating micropipettes, we have the display para makita natin kung nasaan na yung ating calibration. Next, we have the tip ejector collar. Meron siyang parang spring sa loob kung saan nandoon yung spring para ma-eject natin yung ating pipette tips if hindi na siya gagamitin. Next, yung kanyang tip cone. Next, we have the calibration tool, pang-adjust, and the micropipette stand. Pakitandaan po. So, on your left side, meron naman tayong isa pang another example of your pipette, micropipette. We have the plunger button, tip ejector, ayan, micrometer. Ayan, i-discuss po natin yung mga functions nila later on, pero pakitandaan lang po yung kanilang basic parts. So, your micropipettes can be spelled as micropipette with single of everything, pero mostly ito yung ginagamit nating spelling, the micropipettes. We have the two most common and widely used micropipettes. We have the air displacement and positive displacement. Again, the two most common and widely used micropipettes inside the laboratory are air displacement and positive displacement. These pipettes are capable of delivering liquid volumes from 1 to 1,000 UL. Okay, so ang ginagamit po talaga natin sa mall bio na pipette, yung mga micropipettes kasi yung mga samples talaga natin in the mall bio, mga maliliit lang talaga sila in nature. So micropipettes will do. Some micropipettes are designed to deliver a fixed volume and others can deliver variable amounts of sample. Your air displacement pipettes are piston-operated devices. A disposable one-time use polypropylene tip is attached to the pipette barrel. So yung mga pinakita ko po sa lecture part natin na pipette tips, they are all made of polypropylene tip. Plastic siya pero ang pinaka-material niya is polypropylene tip. The pipette tip is placed into the liquid to be aspirated and is drawn into and dispensed from this tip. Next, we have the positive displacement pipettes uses a capillary tip that may be siliconized glass, or plastic. Yung mga pinakita po natin sa lecture part, mga air displacement lang yon kasi yung kanyang pinaka-pipette tips, ang material lang nagamit doon ay mga plastic. So sa positive displacement, siliconized glass or plastic, pwede po sila. This type of pipette is useful if a reagent reacts to plastic. Your positive displacement pipettes are use a Teflon tip plunger that fits tightly inside the capillary. These capillary tips are reusable and carry over and negligible if the pipette is properly maintained. Some procedures require a washing or flushing step between samples. So pakitandaan po muna yung definition ng dalawang pipette natin and then i-differentiate natin siya sa mga susunod na slide. So we have the air displacement and positive displacement pipette. So sa kanilang mga unang parts, medyo same naman sila. Nagkaiba na lang sila sa latter part. So we have the push button. Okay, so ang tawag dito sa kanya plunger button or push button. Pwede naman. Yun yung ating pinaka-pinipress using our thumb. If we want to eject the sample, ay the pipette, or we want to aspirate a sample. Aspirate, ibig sabihin, kukuha ka. Diba? Aspiration. Next, itong push button or yung plunger button, dito po, sa ganitong type ng pipette, dito na-adjust yung large volume adjustment knob. Okay? Dito, itong thumb wheel na to, it is also known as adjustment ring. Nakakapag-adjust din po tayo dito ng calibration, pero yung mga maliliit na volume na lang. So imagine niyo yung microscope, merong coarse adjustment knob. Yung malaking adjustment doon nagaganap sa coarse adjustment knob. Pagka naman gusto mong maliit na lang yung pinaka-adjustment mo sa fine adjustment knob. Sa pipette po, ganun siya. So kung kunwari, meron kang 1,000 UL, wait lang. May 1,000 UL ka, 100 to 1,000 UL na pipette. So gusto mo siyang i-adjust to 900. So ang gagamitin mo is si push button. Dito po, yung large amount. Pero pagka kunwari nasa 900 na yung volume mo ng pipette mo, gusto mong gawing 908. Ay, 908 pala yung kailangan ko. Dito ka na sa thumb wheel, mag-a-adjust. Okay? So ito po, pwede natin siyang tawagin display or volumeter display. Next, we have the tip ejector. Meron yung parang pinaka-spring. Next, we have the shaft and the disposable tip. So sa positive displacement pipette, almost same lang sila. Nagkaiba lang po dito sa capillary and sa piston. Iba yung kanilang tip na ginagamit. So micropipettes should be verified for accuracy and precision before they are put into use and monitored during the course of the year. The frequency of verification depends in part of the amount of use and the requirements put forth by the licensing or accrediting agency. So ang ating mga micropipettes, they are not just a simple equipment that are used in the laboratory. They still need yung preventive maintenance. So kung iniisip nyo yung mga malalaking machine lang sa lab, yung ginagamitan ng preventive maintenance, yung kina-quality control, mali po kayo dyan. Even yung mga micropipettes po natin, monitored po yan ng mga medtech. Kasi gusto natin makakuha ng quality result by providing accurate and precise pipette. Again, we wanted to get a quality result Paano po natin ma-achieve ang quality result? Dapat ang ating mga equipment and machines are calibrated and they can produce accurate and precise results. So, paano mo ma-achieve din yun? Kailangan dapat yung equipment mo, yung nakukuha mong sample, accurate and precise para hindi erroneous yung result mo. Proper maintenance of air displacement pipettes are very important. This type of pipette has a fixed stroke length that must be maintained. It also has seals to prevent air from leaking into the pipette when the piston is moved. These seals require periodic greasing to maintain their integrity. So very important po na ma-maintain natin yung integrity ng ating mga samples by maintaining our equipment such as our micropipettes. Positive displacement micropipettes need to have their springs checked. Okay, yung pinaka-spring dapat sine-check and Teflon tips replaced periodically. A slide wire is used to quickly check the plunger setting. These checks does not replace the scheduled precision and accuracy checks. So yung ating mga equipment sa lab, even yung mga micropipette natin, meron po yung preventive maintenance. Pwede po siyang every year or every 6 months. Kasama po yun sa pag-check noong ating license. So ang ating mga laboratory, meron po yung license to operate. So para po mag-grant tayo ng license, magko-comply tayo sa mga different requirements such as yung dapat sine-check po kung okay ba yung mga machine natin sa lab. Next, several procedures are used by laboratories to verify the precision and accuracy of micropipettes. Most of these procedures are time-consuming, especially those that require weighing of water. No matter, this verification procedure must be done to ensure proper performance of the laboratory micropipettes. Even tedious po yung ating process to verify kung well-functioning ba yung mga ating micropipettes. Dapat daanan natin yung isa-isa para ma-maintain po natin yung proper performance of our laboratory micropipettes. So, i-differentiate natin si air displacement versus positive displacement. Air displacement pipetting is highly accurate for standard pipetting application. So ito din yung most common na ginagamit natin sa ating laboratory setup. However, temperature and atmospheric pressure as well as the specific gravity and viscosity of the solution may affect the performance of your air displacement pipettes. Depende kasi meron tayong mga ina-aspirate, di ba? Aspiration yung tawag dyan, na sample na hindi liquid, na hindi ganyan ka-viscous, ay di ba hindi siya ganyan ka-watery. Merong mga viscous samples such as yung mga sputum, okay, di ba masyadong viscous yun. Yung ibang mga nasopharyngeal samples, hindi din po siya masyadong liquidy. So it may affect the performance of your air displacement pipettes. So how does your air displacement pipette works? In aspirating, we have 3 steps. Pag dispensing ibig sabihin, i-dispense, ayan, dispensing yung tawag. Nire-release mo na yung pinaka-liquid in the pipette tip. So, ang ating aspirating, we have 3 steps. Number 1, the piston moves to the appropriate position when the volume is set. Number 2, when the operating button is pressed to the first stop. Huwag mong kalilimutan itong mga terms na to. The piston expels the same volume of air as indicating the volume setting. Next, after immersing the tip into the liquid, the operating button is released. This creates a partial vacuum and the specified volume of liquid is aspirated into the tip. Next naman po, pag i-dispense mo na or i-release mo na yung samples, when the operating button is pressed to the first stop again, the air dispenses the liquid. To empty the tip completely, the operating button is pressed to the second stop or yung tinatawag nating blowout. So sa dispensing, dito po nagkakaroon ng maraming errors, lalo na kapag hindi tama yung press natin doon sa ating first stop and second stop. Marami din pong error pag nag-a-aspirate pa lang. Okay, i-discuss natin yan sa mga video natin later, pero marami pong na-encounter na errors even sa aspirating and sa dispensing. So pag affected tong dalawang technique na to, malamang sa malamang, hindi accurate yung makukuha mong volume. So next, for the positive displacement pipettes, positive displacement pipette is based on direct contact of the piston with the liquid. The aspirated liquid amount depends on the dimensions of the cylinder or capillary and the movement distance of the piston. In positive displacement pipettes, the tips contain both the cylinder or capillary, and the piston. So how does this work? Number one, the piston moves inside the tip to make direct contact with the sample. Number two, the piston moves out, throw the sample into the tip. And number three, when dispensing, the piston descends and the selected volume is dispensed. So ma'am, ang hirap i-imagine pag wala pong video or hindi namin siya nagagawa. So papakita po natin sa mga susunod na slide yung kanyang mechanism. So with an air displacement pipette, the following steps increase the likelihood of accurately and repeatedly measuring a specific volume. Wag na wag pong kalilimutan bago ka mag-work using your pipette, we have to set the volume of the pipette. Okay, alam mo dapat kung ilan yung volume na kukuhanin mo. So, i-adjust mo siya using your plunger button and then yung pinaka-thumb wheel, if applicable. If yung iba, plunger button lang meron, doon mo na siya i-adjust. Next, hindi lang po tao ang nade-depress, pati ang plunger. You have to depress the plunger. Next, i-immerse mo na siya. Okay, una, isa-set mo muna yung volume. Pangalawa, ipe-press mo or ide-depress mo yung plunger sa first stop. Sa first stop lang ha. Next, immerse mo na or ilubog mo na yung iyong tip doon sa pinaka-tube mo sa correct depth. Ano po yung correct depth niya? Just below the surface. Okay, kunwari ito yung iyong tube, meron kang liquid dito. Pag sinoke mo yan dito, just below the surface. Hindi po sasagad dito. Hindi masyadong mababaw dito, dapat just below the surface. Just below the surface, which can vary by the pipette and the tip, and smoothly let the plunger go to its resting position. Next, wait about 1 second for the liquid to flow into the tip. Put the pipette head at 10 to 45 degrees, pero sabi ng iba 20 to 45, pwede naman. So, ang gagamitin na lang po natin 10 to 45 para covered pa din niya si 20 to 45. Against the wall of the receiving chamber and smoothly depress the plunger to the first stop. Okay, next. Wait 1 second and depress the plunger to the second stop. Huwag pong kalilimutan. Slide the tip up the vessel wall to remove the pipette and allow the plunger to return to its position. So, ano yung sinasabi mo dyan, ma'am? Pakikabisado po muna tong step. And then, i-apply natin siya sa video na mapapanood natin. Okay? Okay, so kung mapapansin po ninyo, ang ating mga micropipettes nasa pipette stand siya. If hindi po natin gagamitin yung ating mga pipettes or tapos na natin siyang gamitin, dapat ibabalik natin siya sa ating pipette stand. Kasi po, malakas daw ang tendency na masira yung mga pipette pag hindi po siya nakalagay sa tamang stand. Parang cellphone stand lang siya.
Pipetting tutorial, how to pipette correctly. I'm using a 2-button pipette. It has a control button with 2 stops.
Ayan yung first stop, yun yung second stop.
And an ejector button.
Okay, ito naman yung ejector button. Ito plunger button siya, pero yung pinakita niya, first stop and second stop.
Pipetting starts when you attach the tip. Apply light pressure to insert the pipette into the tip. There is no need for force or moving from side to side.
Ayan. So once po na ilagay nyo na yung pinaka-pipette, micropipette ninyo doon sa pinakalagayan natin or nakapag-attach ka na ng pipette tip, hindi naman po kailangan na itaktak pa or i-press ng masyadong madiin. Light pressure lang kasi fit naman sila to one another. So mag-fit naman yung pinaka-pipette tip doon sa inyong pinaka-shaft. Kasi pag daw masyado mong ginamitan ng force or tinaktak mo siya, ang tendency magkakaroon ka ng strained arm and masisira mo din yung iyong micropipette.
This would only strain your arm and damage the pipette.
Ayan. So fit naman sila, make sure lang.
When aspirating liquid, 2 factors influence accurate liquid. The aspiration angle and the immersion depth. The aspiration angle should be vertical. Otherwise, too much liquid is aspirated. The immersion depth, meaning the depth of the pipette tip inside the liquid, should be as large as necessary, but as small as possible. If the tip is immersed too deeply, additional liquid can be easily aspirated due to the capillary effect. Press the control button down to the first stop.
Ayan. So, if i-press mo siya sa first stop, pag naset mo ni volume first stop,
and immersion
ayan, just below the surface lang.
slowly release the control.
Ayan, slowly lang daw po.
Press the control button down to the first stop again. And aspirate once more. Repeat this 2 to 3 times to saturate the air in the tip. When dispensing liquid, the angle of the pipette should...
So, yung ginawa po niya, nag-aspirate lang siya ng sample. Aspirate, ibig sabihin, kumuha siya ng sample, papunta dun sa pipette tip. And then, sinubmerge lang niya and then inulit lang niya ng 2 to 3 times para mawala yung saturation ng air. Okay, pipette ng 3 times. And then, ang gagawin na niyang next step is yung dispensing or papakawalan or i-release na niya yung sample coming from the pipette tip. So, yung tinuro natin kanina, 10 to 45 degrees po yan with contact to the vessel wall. Ito po siya.
45 degrees, whilst the tip should stay in contact with the vessel wall. This guarantees optimal flow out of the liquid into the target vessel. Press the control button down to the first stop.
Ayan, 10 to 45 degrees. Slowly mo i-release. And then yung second stop, yung blow out. Okay? So, nung nag-aspirate ka, first stop lang yon nung kumuha ka ng liquid sample. And then, nung inilipat mo siya sa ibang microcentrifuge tube, second stop na siya. First stop and second stop para lahat po ng mga liquid na kino-contain ng inyong pipette tip, mas matransfer mo siya fully. Okay? Nung nag-aspirate ka, nung kumuha ka, dapat vertical lang angle, 90 degrees. Pero nung inilipat mo siya sa ibang centrifuge tube, microcentrifuge tube, nung tinransfer mo na, nung dinispense mo na, naka 10 to 45 degrees angle na po siya.
Second step. This ensures that the tip is emptied completely. The last step during pipetting is ejection of the tip into a garbage bin by pressing the ejector button.
Ayun lang. Press mo lang yung ejector button.
Achieve accurate and reliable pipetting results with soft tip attachment, vertical aspiration, a low immersion depth, and a 20 to 45 degree dispensing angle directly in contact with the vessel wall. So, improve your pipetting skills.
Okay, proceed po tayo sa ating next video. So, kung tinuruan na tayo ng proper pipetting skills, dito naman ituturo yung mga common errors that we may encounter when working inside the laboratory. So, madali lang siyang tingnan, pero pagka ginawa mo na siya, medyo mahirap talaga yung pagpapipet. So, ito po yung mga common errors natin.
Here are some things to be aware of when pipetting. The first is not putting the pipette tip on firmly enough.
Ayan. So, sabi nga po dun sa tinuro natin kanina, hindi naman masyadong madiin, hindi din dapat masyadong light lang yung pagkaka-press, yung pagkaka-contact mo between sa pipette mo and pipette tips mo. Kasi ang tendency, magkakaroon ka ng loose pipette tip, so malalaglag siya, madumi na, hindi mo na pwedeng gamitin. So, dapat tamang pressure lang para mag-attach yung iyong pipette tips to your micropipette.
So it easily falls off your pipetter.
Okay, number 2,
Next,
tilting
always
yung
keep the
pipettor.
pipette tip pointed down. If you tilt it up, liquid could run into the pipette, damaging it or causing contamination.
Okay, so once po na nag-aspirate ka na or nahawakan mo na si pipette at nakapag-pipette ka na sa iyong microcentrifuge tube, bawal na bawal mo po siyang i-tilt. Okay, dapat naka 90 degree angle lang and then dapat sure ka na. Once na nakapag-pipette ka na, ilipat mo na sa kabilang tube mo. Bawal na yung unsure ka pa or gumalaw yung kamay mo na nag-bend siya kasi ang tendency, yung liquid coming from the pipette tip, it will travel to your micropipettes, magkakaroon ng contamination.
Next, remember to always let the plunger up slowly.
Slowly
Let
lang
it
daw
up too
po.
fast.
Oo, wag yung sobrang
You're
bilis na
likely to throw
ganyan.
an air bubble up into the pipette tip.
Kasi mag-introduce ka ng air bubble. Ayan o, pag sobrang bilis. Hindi rin naman po dapat sobrang bagal. So ito yung most
I've set
common.
this pipette to 250 microliters. If you pipette properly by pushing to the first stop, you draw up exactly 250 microliters.
Ayan, pag
If instead you push all the way to the second stop before
kapag ka nag-aspirate tayo, first stop lang. Yung second stop, ginagamit yun pag nagde-dispense na. Kasi pag second stop yung ginamit mo sa ating aspiration, ito yung mangyayari.
you
Tingnan
draw
mo.
up much more than
Ay no, ang
250
dami. Hindi na
microliters.
accurate yung volume mo. Okay, so yun po yung mga common errors na i-encounter natin. Wag na wag pong kalilimutan yung ika-4 na error na pag nag-aspirate ka pa lang, dapat first stop. Bawal po yung second stop kasi mas marami yung volume na makukuha mo compared doon sa desired volume na kailangan mo. Okay, next. Next video naman po natin. Sige, wait lang. Ayan, so that naka-vertical lang yung angle natin. First stop, slowly mong i-release. Ayan. And then pag i-dispense mo na, naka 10 to 45 degrees against the vessel wall. And then eject mo na yung iyong pipette tip. So nakita po ninyo, balikan lang natin yon, nasa pipette stand po siya. So different yung volumes natin, different pipette tips yung gagamitin, and different pipette. So ayan. Kung napapansin po, ang ating pipette tip, meron siyang filter. Ito yung tinatawag natin na filter tips. Okay, so ang ginagamit po ito sa mga COVID-19 testing laboratory para po ma-prevent yung pag-produce ng aerosol. May filter siya dyan. So kung napapansin ninyo, nung nag-a-aspirate pa lang tayo, naka 90 degrees, vertical angle. May tendency po na hindi accurate yung makuha nating volume kapag ka naka-slightly bent pag mag-a-aspirate pa lang. Okay, so nag-a-aspirate lang ng 2 to 3 times. Tapos kapag ka i-dispense, dapat against the wall, 10 to 45 degrees angle. Ayan. Tapos hindi din po fully submerged hanggang dulo, dapat just below the surface lang. Hindi din po sobrang babaw, nandito yung filter tip, hindi po ganun. Bawal yung nandito din sobrang lalim, just below the surface. So next, kuha naman tayo ng another micropipette and another filter tip. Ayan, aspirate lang just below the surface. Slowly. Aspirate lang ng 2 to 3 times para masaturate po yung air. And then make sure na walang air bubbles. And then dispense mo siya 10 to 45 degrees Celsius against the vessel wall. Okay? Submerge mo lang just below the surface again. Walang air bubbles. Pwede mo nang i-transfer sa ibang microcentrifuge tube. And then i-angle mo lang. So baka nagtataka kayo bakit iba-iba yung pipette na ginagamit kasi po ang aming lab demo ay we are being required to pass a video using different micropipettes para mapakita yung aming proper pipetting technique. So ito parang 200 UL ata yung requirement naman. Submerge mo lang, aspirate, slowly, 2 to 3 times. Okay, just below the surface. And avoid introducing bubbles. Ayan. So, ma'am, bakit hindi nilipat? Kasi ganun talaga. Yun yung unang requirement. Wala lang, pa-video lang kasi yan. So make sure wala pong maiiwan doon sa ating pipette tips na mga liquid para accurate yung measurement natin ng ating volume of the liquid. Ayan. 10 to 45 degrees again. Yan. Make sure na naka-second stop or blow out para lahat po ng liquid na ilagay sa kabilang microcentrifuge tube. So, pagtapos na tayong gumamit ng ating micropipettes, bukod sa ilalagay natin siya sa isang pipette stand, dapat i-adjust natin siya sa kanyang maximum volume. For example, itong inyong micropipette na yan, meron siyang volume na 100 to 1,000 UL. Since adjustable siya, dapat po ibabalik natin siya sa 1,000 UL, yung kanyang maximum capacity. And then balik mo na siya doon. Para daw po hindi masira yung kanyang spring at hindi maapektuhan yung kanyang accuracy, sabi po ng mga ahente at sabi sa ating turo. Ayan, ganyan po yung tamang pag-aalaga ng ating mga micropipettes. So next, proceed na po tayo in the proper specimen collection of your COVID samples. So na-discuss na natin yung ating proper pipetting techniques. So it's all up to you kapag ka na-apply na natin siya sa ating face-to-face setup. But first, at least na-discuss na natin yung kanyang principle. So next, let us proceed to your proper specimen collection for your COVID samples. So in collecting your COVID samples, we have different specimen types and we have the upper respiratory samples. Upper respiratory samples. Pag upper respiratory, unahin natin si nasopharyngeal specimen. Nasopharyngeal specimens are usually collected by entering the pharynx through the nose. Again, entering the pharynx, sa nose po siya dumadaan, pero ang target natin is to collect samples from your pharynx. But they may also be collected by going through the mouth and sweeping the area of the pharynx that is above the uvula. So here are some of the key points in collecting your nasopharyngeal specimen or nasopharyngeal swab kung naririnig si NPS. Always verify the order before collecting the sample. To collect the sample of the nasopharyngeal swab, it is necessary first to measure how far the swab needs to be inserted for the collection. Okay, may mga nagsasabi po sa ating literature na 5 to 7 centimeters daw po siya. So ma'am, ano po yung indication na na-collect na po siya or tama yung depth, yung lalim no, na ipasok namin na swab? Usually may indicator yan dito. May hati yan dito. So yun yung kanyang correct depth. Kasi pag masyadong mababaw, hindi mo na target, hindi mo nakuha yung talagang virus if ever na present, or pag masyadong malalim naman, baka masaktan naman si patient. Too much invasive na siya. Respiratory specimen should be collected as soon as a decision has been made to test someone, regardless of the time of symptom onset. The guidance below addresses options for collecting specimens. So for your nasopharyngeal specimen, important na trained po yung gagamit at gagawa noong procedure. Okay, proper specimen collection is the most important step in the laboratory diagnosis. Kasi pag mali yung pag-way ng pag-collect natin, it will affect your pre-analytical phase. So for initial diagnosis po ng ating SARS-CoV-2 infection, dapat upper respiratory specimen po yan. So it includes your NPS and OPS. So yun talaga yung pinaka-first choice natin. NPS or OPS kapag ka mag-test po tayo ng mga COVID-19 samples. However, pag hindi po applicable, pwede natin i-test naman si lower respiratory tract specimen. So sino po yung mga pwede nating pag-collectan ng mga ganito? These are the patients that has been hospitalized. Pagka mga comatose patients, hindi po, or may mga hindrances na hindi po natin sila maswab through nose and through mouth, we can collect samples sa lower respiratory tract. And ano-ano po yun? Yung mga sputum samples po natin. Okay? Pagka talaga namang severe yung cough ni patient, pwede po natin gamitin yung kanilang mga sputum. However, meron pong limitations. Hindi pwede yung mga samples na induced sputum. Ano po yung mga induced sputum? Ito po siya. Okay, yung mga patient minsan kasi Pag hindi nila kaya makaproduce ng sputum on their own, they are being subjected to nebulizer. So imagine yung ina-asthma ka tas nini-nebulizer. In that way, mai-induce yung pag-collect ng sputum. So hindi po pwede na gamitin tong sample for COVID-19 testing kasi it may produce aerosol. Okay, aerosol is hazardous, so hindi po pwede. Lower respiratory samples, check, pwede naman, pero sputum lang. Hindi pwede yung sputum via induction. Tandaan po yan. So your nasopharyngeal specimen or oropharyngeal specimen, it should be performed by trained healthcare provider only. And use only synthetic fiber swab with thin plastic or wire shaft that have been designed for sampling the nasopharyngeal mucosa. Ano po yung mga bawal na swab? Yun po yung nabanggit ni ma'am sa lecture. Bawal yung may calcium alginate swab or yung wooden shaft. Yung mga ganito, yung may wooden, okay, na body, bawal na bawal po yan because they may contain substances that inactivate some viruses and then it may inhibit your molecular test. So, ang tendency, it may lead to erroneous results or pwedeng maging false negative. CDC recommends collecting only the nasopharyngeal specimen, although an oropharyngeal specimen is acceptable specimen type. So usually, talagang ang practice sa Philippines, nasopharyngeal and oropharyngeal po. Pero sa mga bata, if medyo mahihirapan po tayo to collect nasopharyngeal sa mga bata at masyado malikot, applicable, pwede naman si oropharyngeal. So here is the instruction in collecting your nasopharyngeal. Pagka po nasopharyngeal, mas manipis yung shaft. Pagpansin ninyo, sa oropharyngeal, medyo mas makapal-kapal. Okay? So ito po yung sinasabi ni ma'am na indicator kung hanggang saan lang yung lalim. Merong parang marka dyan. Okay? So basahin lang natin yung pinaka-step-by-step procedure. You have to tilt the patient's head 70 degrees po. Gently and slowly insert the mini tip with a flexible shaft. So pag sa ilong kasi dapat medyo manipis and flexible siya. Hindi naman manipis in a way na magbe-break sa loob. Flexible po and mini. Through the nostril parallel to the palate. Again, through the nostril parallel to the palate until resistance is encountered. Ma'am, paano po namin malalaman kapag na-reach na namin yung kanyang back of the pharynx? Pag po may naramdaman ka ng resistance. Resistance, ibig sabihin yung pumapalag. Parang na may na-hit ka na wall. Yun, mararamdaman mo siya. And then is encountered or the distance is equivalent to that far of the ear of the nostril of the patient, indicating contact with the nasopharynx. So you will know na na-reach mo na yung dulo or nasagad mo na pag may naramdaman ka ng resistance. Gently rub and roll the swab. Leave the swab in place for several seconds to absorb the secretion. So ang recommended dito, mga at least 10 seconds na i-roll mo siya sa ilong. And slowly remove the swab while rotating it. So habang hinahatak mo siya, papalayo yung swab, habang tatanggalin mo na, i-rotate mo po so that may mga kumapit doon na virus if present pa talaga. Specimens can be collected from both sides using the same swab. Tandaan po yan. So ang usually pag nagsa-swab si ma'am, dalawang nostril po talaga para sure. But it is not necessary to collect specimen from both sides if the mini tip is saturated with fluid from the first collection. So, pwede naman pong hindi naman necessary na both na nostril, pero si Ma'am Trina usually dalawang ilong po talaga para sure. If a deviated septum or blockage create difficulty in obtaining the specimen from one nostril, use the same swab to obtain the specimen from other nostril. Kasi hindi naman po natin masasabi na if yung isang patient mayroong problema dun sa kabilang ilong. So pag hindi tama pag feeling mo hindi ka nakakolect ng tama dun sa kabila, may option ka pa naman sa kabilang ilong to collect. Okay? And then place swab tip first into the transport tube provided. So yung VTM mo, ilalagay mo na agad directly once na nakakolect ka, pataob. Okay? Place the swab tip first. Yung tip, dapat siya yung nakasubmerge doon sa parang culture media. Next, instructions for collecting your oropharyngeal. Dapat po widely open yung mouth ni patient and then yung insert mo yung swab doon sa posterior pharynx and tonsillar areas. Doon po, dito sa ito kasi tonsils to, diba? Ayan, dito mo po siya sa swab, hindi dito. Hindi sa alveolar, hindi. Dito po sa nostril and nasopharynx. Rub the swab over both tonsillar pillars and posterior oropharynx and avoid touching the tongue. Avoid touching the tongue, teeth, and gums. Baka mamaya, pag huhugutin mo na yung swab, matouch mo yung pinaka-tongue and then yung gums, wag po. Bawal po yun. Place the swab tip first into the transport tube provided. So, ganun din po, kagaya ng nasopharyngeal swab, yung pinaka-swab yung nakasubmerge doon sa ating liquid. So, ito lang yung ating nasopharyngeal specimen collection steps coming from your CDC. So, dapat alam po muna natin kung ano yung mga parts of the nose, ng ating mouth, para matarget natin yung tamang organ na ating isa-swab. And please ensure to wear your personal protective equipment in doing so. So, ayan, 70 degrees lang po and gently, slowly insert the mini tip or flap swab kung tawagin through the nostril parallel to the palate. Ayan. So, panoorin lang po natin yung video para ma-apply natin yung step-by-step procedure na sinabi
COVID-19
ni Ma'am.
diagnostics, performing a nasopharyngeal or oropharyngeal swab. It is essential to follow proper infection control measures when samples are collected from patients with a suspected coronavirus infection. Among other things, the examiner should wear an N95 respirator mask, gown, protective goggles, and gloves. To save resources, we will refrain from using each of these items in this video and instead only show the technical details of sample collection. Let's begin with the nasopharyngeal swab. The patient should be alert and cooperative. Allow them to first blow their nose. The patient should sit in a relaxed and comfortable position during the sample collection process. Tilt the patient's head back slightly and support it with your non-dominant hand. If necessary, lean the patient's head against a wall to minimize jerky movements. Stand slightly offset from the patient to avoid the risk of contamination in case of a sudden cough or sneeze. Be sure to advise the patient of potential discomfort during sample collection and let the patient know that they are welcome to close their eyes. Sample collection should only be completed using sterile swabs made from artificial cotton with flexible plastic shafts. Calcium alginate swabs or swabs with wooden shafts must not be used. These materials can inactivate viral particles or inhibit PCR tests. Furthermore, wooden shafts are more likely to cause patient injury. Hold the swab like a pen between the thumb, index.
Ayan, yan po yung isa sa mga mahalaga natin na dapat tandaan in collecting your nasopharyngeal swab. Hindi po siya basta-bastang hinahawakan na parang trip mo lang, hawakan na parang doorknob or what. Dapat para kang maghahawak ng pen. Kasi in that way, doon mo mararamdaman yung resistance. Yan po yung tamang way ng paghawak ng ating swabs, cotton swab. Okay? Dapat para mo siyang hinahawakan like a pen para po maramdaman natin yung resistance once na nandoon na sa nasopharynx ng ating patient.
Middle fingers. Maintain a loose grip that allows the swab to accommodate any resistance encountered during sample collection to reduce the risk of injury. Avoid using the following hand
Ayan,
position
bawal po
during
yung mga
sample
yan.
collection. Start by inserting the swab horizontally into the left or right nostril. Carefully advance the swab while maintaining a course that is close to both the septum and the floor of the nose, parallel to the palate. Do not advance the swab upwards, but instead straight back until resistance is felt as the swab reaches the posterior nasopharynx. When collecting samples from an adult patient, this corresponds to a travel distance of approximately 5 to 6 centimeters or 2 inches.
Ayan,
Leave
or
the
5 to
swab
7
for a few
centimeters.
seconds while
Tapos
gently
i-rotate
rocking the
mo
wall
siya.
by twisting the
Mga
swab
10
shaft.
rotations.
Slowly and gently remove the swab.
Ayan. Tapos rotate mo din siya
Immediately
habang
insert the
nire-remove.
swab into the sample collection tube,
Okay, lagay
which
mo
may
agad
contain
dun sa
2
yung
to 3
VTM,
milliliters of viral transport media.
pataob.
If a nasopharyngeal swab cannot be collected for any reason, an oropharyngeal sample can be also collected through the mouth.
Ayan.
Again, inform the patient that the smear will feel uncomfortable for a short time and may trigger a gag reflex. Ask the patient.
Ayun. So, dapat nakataob po siya.
Open their mouth wide, protrude their tongue forward, and say ah. Depress the patient's tongue using a tongue depressor. Gently insert the swab into the oral cavity with
Ayun. So, hindi dapat dito mo siya isuswab.
touching the lips, teeth,
Ayan. Dapat dito sa inyong oropharynx and then doon sa parang tonsils. Doon mo siya isuswab.
tongue, hard palate, or soft palate. These surfaces should be avoided as they are often colonized by a wide range of microbes. Collect the sample from the back wall of the throat. Twist the swab shaft gently but thoroughly, sampling the oropharyngeal wall. Just as with the nasopharyngeal swab, the oropharyngeal swab should now be placed into the sample collection tube and sent to the laboratory as quickly as possible.
Okay po. Proceed tayo sa susunod.
COVID
Ayan. So, yun na yung proper collection, proper manner of collection of your upper respiratory samples, which includes your nasopharyngeal and oropharyngeal. Next naman, pag-usapan natin si lower respiratory tract samples that can be used, okay, can be used if hindi available yung first choice natin, which is upper respiratory samples. Pwede daw po si sputum. Okay, lalo na kapag ka medyo productive naman yung cough ni patient, pero wag na wag daw pong gagamit ng sputum coming from induction or yung mga sputum na galing sa mga patient na nag-undergo ng nebulizer. Okay, educate the patient about the difference between sputum kasi alam niyo po ang mga sputum medyo mahirap pong i-collect yan. Kasi ang sputum galing yan sa ating deep cough or expectorated galing sa lungs. Baka mamaya ang maibigay sa'yo na sample ay galing sa oral secretions or saliva lang. Okay? Galing lang po sa mouth yon. Hindi siya galing sa lungs. So, if ever may present man na pathogens dyan, hindi ma-detect yung targeted mong pathogens kasi hindi galing sa lungs. Galing lang siya sa iyong saliva. So, next. Ayan. So, the procedure is to instruct the patient na ito yung tamang gawin. So, magbibigay po tayo sa kanya ng sterile container. Wag na wag po muna natin bubuksan not unless capable na siya to produce the sputum. Next, the mouth should be free from foreign matter and may be rinsed with filter or sterile water prior to the collection. Okay, sputum collection po ito. Number 3, take deep breath through your mouth and cough up the mucus from deep in your lungs. Breathing deeply over a pan of boiling water may help raise the sputum. So usually yung mga sputum samples natin, mas maganda po sa umaga talaga siyang kino-collect. Open the container and hold it close to your mouth. Cough the mucus into the container. So ang sabi dito, sterile kasi yung ating container. I-open lang siya once na capable ka na to produce your sputum. Hindi mo siya pwedeng buksan in advance. 1 to 2 teaspoons of specimen is adequate. The container should not be more than 1/2 full. Once collected, screw the lid on tightly. Write your complete details doon sa pinakabote. And then you may submit it in the laboratory. Specimen should be double bagged in the plastic bags provided. Store the specimen in the refrigerator until transported. So itong mga sputum samples natin to, pwede po itong gamitin sa molecular biology or COVID-19 testing sample, kagaya po ng sinabi ni ma'am, pag hindi po available yung upper respiratory samples. Pero pagka mga induced samples yan, induced sputum, bawal na bawal po yan. And then itong sinasabi ni ma'am na sputum collection, pwede din po yan sa mga microbiological testing natin. So ito po siya, merong proper manner of collection. You have to inform the patient. And then, sabihin mo sa pasyente, huminga siya ng malalim ng 2 to 3 times, tsaka siya mag-expectorate. Para po, sputum talaga yung makolek at hindi saliva. Well, that concludes our discussion for your laboratory in the period 3 of molecular biology. So, ito na yung pinaka-last discussion ko sa inyo. I hope you had fun as much as I did kasi it was my first time teaching molecular biology kasi ngayon pa lang naman to na incorporate sa inyong curriculum. And thank you so much for the wonderful semester. God bless everyone.